15. We also Hi, Sarah. So happy you're here. Hopefully school's done or is about to wrap up for you, so you can enjoy your summer. I also see Kirk and Arthur just joined us. And for those who are just joining too, I mentioned at the beginning that since this is a large group and a webinar, we have your camera and mute button. We have your camera and microphone off, but will be opportunity to come off of mute later on in the call. So feel free to hang tight. And in future calls, we'll give opportunities for everyone to be up the whole time because I know it's great to see other people's faces across the country. But our first go ahead at this, we'll keep everyone just off just to make sure that nothing technology wise goes off. And we'll start in about 2 minutes. I know we have people on West Coast time joining us today and people running home from work and all that stuff. So. And Kelsey, do you mind checking the Facebook group just to make sure no one is posting in there having issues?
Yep, I'll pop in there now.
Thank you. Hi, everyone. Thank you for being here. I saw a few more names pop up. We'll start in about 1 minute. Next time I'm going to have like waiting music. That would make it more fun. And let me just check my email again to make sure no one's having issues. Oh, hi, Christy. I'm happy you're able to post in the chat. Yay. Okay, I feel better. I was nervous that y'all might be able to post in the chat as external folks. So glad it worked. Awesome. Well, we'll go ahead and get started. I know we have a smaller group, about 15 people right now, but we had about 70 register. So I'm sure more people will pop in as they are heading home or wrapping up dinner and all the things. We already start our recording and you'll see some friendly Shatterproof faces up on the screen for now. Kind of like I said, if you heard me pop in, we have, and I'm making sure now because now my email is blowing up. So I'm making sure that, okay, great. I am happy to be here. We'll make sure to have time throughout for people to come up, hopefully on camera, and unmute yourself if you have any questions or anything else you wanted to add at the end of the call. But with this being the first call, we want to make sure everyone just is able to listen and learn. There is a chat option, which I'll talk through how to open here in a second, as well as a Q&A portion. So you're welcome to add anything throughout today's call too. So yeah, thank you all so much for joining us for our first Shatterproof all volunteer call of 2025. I know a lot of our ambassador group used to have these pretty often, so I know it's been a while. So happy we were able to get it on the calendar and that all of you were able to join. As some of y'all may know, my name is Gab Tuggle and I'm the Volunteer Engagement Director, and we're just so happy to have everyone here. Before we dive in, like I promised, I wanted to give everyone some quick tips and tricks regarding Teams, as I know this is a new platform for Shatterproof, so not everyone is familiar with all of its cool tools. So depending on how you access our call today, whether you are doing it via the app or the browser, your control panel may be above or below the slide deck. There's also the opportunity to turn on live captions. If you click the three dots where it says more, as you can see here in the screenshots, you can select language and speech and choose turn on live captions. They're super accurate and they keep up pretty with pace, even with my fast talking. So it should be a great way for you to watch anything that we're talking about today. And then also, like I've mentioned before, since this is a webinar, everyone will be automatically muted, but if not, please mute yourself during the presentation. And if needed, we may need to mute you on our end just to reduce any background noise. And as promised, at the end, we should have enough time for everyone to ask questions and participate in discussions if you so choose. During that time, we'll ask people to raise their hand via the raise your hand icon that you will see on the top of your toolbar. We'll also unmute you from our end and hopefully be able to turn on your camera as well. And like I said, too, you'll have a chat function. There's a little chat bubble that you should be able to click on, open up the chat. Christy was awesome and tested it as an external user, so all of y'all will be able to use that throughout today's chat. There's also a Q&A section if you just have like a really specific question that you don't want to get lost in the mumbo jumbo of the chat and want us to clearly see at the end. My colleagues here that you see on the screen will be monitoring the chat throughout the call today too, so they'll be able to do any quick responses if any links or anything like that pop up, or just let you know that we'll answer your question at a later time. So excited to dive into things. Here is our agenda for today's call. So we'll start by grounding ourselves in Shatterproof's mission and work. Next, we'll take some time to get to know some of our amazing Shatterproof staff and learn a little bit more about their roles within Shatterproof. We'll dive into the discovery of our plans for volunteerism at Shatterproof moving forward. We'll learn about the different functional work happening at Shatterproof and how each of you can get involved, and then we'll wrap us up for today. I also wanted to note that today's call will be definitely more listening than the rest of our all volunteer calls that happen throughout the future. I really hope that our future calls will be a better balance of information sharing and updates, and then also giving you all the time to connect with fellow volunteers, share experiences, and build community, because that's why we're all here at the end of the day, right? So excited to read our mission today. And I'm also excited. This is my first all Shatterproof call that I'm co-leading. So I'm just happy to be here. So Shatterproof provides trusted guidance to communities, removes systemic and social barriers to recovery, and mobilizes the country to advocate for change and to end addiction stigma. And our vision is Shatterproof is a national nonprofit that believes no one should suffer or die from substance use disorder, a preventable and treatable disease. In future calls, I would love for volunteers to have the opportunity to read our mission and vision and also reflect on what the Shatterproof mission means to them. So if you're ever interested in doing that, sharing your story, sharing why you're here, sharing why this mission matters, and why you chose Shatterproof, please feel free to email me. You can even post it in the chat, and I'm happy to follow up with you to get you on the docket for future calls. And then next, I want to talk about our pillars. I know a lot of us see this work. We saw it maybe if we got trained as ambassadors or if we've been a volunteer for a long time, or if you've dove into our website. But we have these guiding pillars to guide the work and all of the things that we do here at Shatterproof and all the things that we have our volunteers do at Shatterproof. So our first pillar, and I won't dive in too much because we have some really awesome leads here who will talk about how their work integrates into these pillars, but our first one is transforming addiction treatment. We also work on ending addiction stigma. We are working on educating and empowering communities, and we're doing all of this through advocating for change. Like I said, we'll be hearing from multiple Shatterproof staff who oversee this super impactful work happening throughout these pillars and how each of you as our volunteers can engage in this important work. So we'd love to have all of you introduce yourselves in the chat. So while the staff is doing their introductions, please share with us your name, where you're located, and how long you've been engaged with Shatterproof. Obviously, only if you're comfortable. I also know the importance of connecting with fellow volunteers, so you're also welcome to share any contact information and/or social media handles if you are comfortable with that and you're wanting to follow other volunteers online. Oh, you're not seeing anything on the screen. That's a bummer. Is anyone else seeing anything? Christy or anyone else? Kristen and Laura, can all of y'all still see it?
I
Oh,
can
all
see
good
it.
on our end. Okay.
But I don't know if the participants can.
It looks like Lauren, Christy can see fine too. Arthur, you might need to leave and come back in sometimes. It will pop off if I share it at a certain time. So if you leave and come back, it might pop up. And if it doesn't when you come back, I can work on resharing my screen. Sorry about that. But yeah, please feel free to share and introduce yourselves in the chat using these prompts. So as I mentioned before, my name is Gab Tuggle, and I'll be facilitating our call today alongside this incredible team. My pronouns are she and her, and I live in Raleigh, North Carolina. Like I said before, I am the Director of Volunteer Engagement, and I get the incredible opportunity to oversee the implementation and continuous improvement, as well of Shutterproof volunteerism, as well as all communication regarding this work, which is probably why many of you have seen my name pop up in your email inbox or requests for meetings and calls and all the things. So I'm so honored to be here. Like I said, I also wanted to mention we have our new volunteer engagement intern also on. They're not going to come up, but I wanted to take a minute to introduce them. Their name is Ari Wolf, and a lot of you will be hearing from them this summer through email, as they'll be working alongside me directly in creating relationships with you all and implementing you all into your tasks. And lastly, before I pass it to Kelsey, I also wanted to mention that there's multiple Shutterproof staff on the call today too. So if you're here and you are a Shutterproof staff, I'd love for you to introduce yourself in the chat as well. With all that being said, I'll pass it over to Kelsey.
Thanks, Gab. Hi, everyone. I'm Kelsey Lucci. As you can see, title is Senior Director of Fundraising Strategy and Operations for our peer-to-peer team. Basically, that means a lot of communications and back-end logistics are coming from me behind the scenes. I help to make sure our team, who's working with all of our walk participants and volunteers, have all the tools and resources they need, and we have all the tools we need to execute our in-person events. Working on a lot of strategy behind the scenes and communications opportunities. So I'm super excited to be here today and get to connect with all of our wonderful volunteers. I know we're heading into walk season and a lot of exciting opportunities are coming up to partner not only with the peer-to-peer team, but the other teams that are going to be presenting this evening. I'll go ahead and pass it to Jody.
Good evening, everyone. I am Jody Bogle. I'm one of our senior directors of community engagement on the National Stigma Initiative, also known as the Stigma Team. I have the pleasure of overseeing our community engagement strategy and implementation in Georgia, North Carolina, and Pennsylvania, where we have our public health communications campaigns. And I'm also working on some other cross-collaborative initiatives. I'm getting to work with Gab really closely right now on some stuff that we're doing in Houston, and just really excited about the opportunity to engage with volunteers. I'll pass it to Kristen.
Hey everybody, I'm Kristen Pendergrass. I'm Shatterproof's Vice President for State Policy, and I've been here for about 3.5 years. Our policy team, I'll talk more about this in a bit, but it's about 3 people, and together we do all 50 states and the federal level. So if you ever have any questions or want to engage in advocacy, I'm happy to help out. Nice to meet you guys. Laura, I think you're up next.
Yep, bring it up the end. Hi, everyone. I'm Laura Whitaker. I'm the Manager of Outreach and Communications for the Treatment Atlas team. I've been with Shatterproof for about 4 years, and I'm located just in Washington State. My role within my team is really just to support our state engagement team on increasing community awareness of Treatment Atlas, increasing utilization of the website itself, and just promoting Atlas within all our audiences. So very excited to connect with all of you and to be here today.
Thanks y'all so much. I'm happy you're here too. And I see we have some awesome people introducing themselves in the chat too. I'm happy all of you are here. Like I said in the chat, we have some people who've been involved for 8 years, like Judy, and some newer folks who've been involved since 2020 or even within the past few months. Yeah, even Michael joined us this past October at Walk. So happy y'all are here and sticking with us, whether you're new or have been around for a minute. So thank you. Keep introducing yourselves in the chat. We love to see it. And if you see someone pop up in your area, feel free to thumbs up and try to connect during the meeting or after. So as I've been saying since I started literally almost 6 months to the day, my first day here was January 27th. So it'll be 6 months exactly tomorrow. Yeah, I think that makes sense. Maybe 5. I'm bad at math. Anyways, I am really excited to share where we're headed with volunteerism here at Shatterproof. I just really wanted to take a moment to acknowledge that this work has gone through a lot of change and transition over the past 2 years. I know it, I've heard you, I see it, but whether you're brand new or have been with us since the beginning, your commitment and contributions have really mattered, and they still do. So I'm happy that you're here. I'm happy that you're on this call. I'm happy I've seen your names and your emails. Over the past 6 months, I've had the privilege to listen, learn, and reflect on what's working and what's needed. So now it's time to build on the strong foundation that's already here and bring your feedback to life. My commitment is to ensure that you have the structure, support, and opportunities that you've been asking for. And we're going to do this through clear tools, meaningful connection, and ways to take action that truly make a difference. So at Shatterproof, we know that volunteerism isn't just something that we do, it's part of who we are. As we continue to grow and evolve, we recognized the need to clearly define the why volunteerism exists within our organization. And that led us to creating a new guiding statement, our North Star. And this really reflects your importance and will also shape the future of this work. So while the future statement is still being finalized, I am really thrilled to share the heart of it with you today. So this statement is something that we'll see today and you'll continue to see as our guiding light in all the work that we do. And that is volunteerism is the heartbeat of Shatterproof. It's loud, visible, and impossible to ignore. And each of you helped build that, whether you signed up to be an ambassador 8 years ago or showed up to a Boston walk or have just emailed me within the past few weeks that you saw us on a Facebook ad and you wanted to be here and you wanted to make a difference. At the bottom line of all of that, each of you came to us with purpose and passion. And so now we're building the structure to help you turn that passion into action across all pillars of Shatterproof's mission in ways that are meaningful to each of you. So we're building a volunteer ecosystem that really meets you where you are. You heard, if some of you have met with me, you heard me talk about this. You heard me talk about, I don't want to build a box around you as a volunteer. I want to build boxes for all of you to stand upon to do the work that you're wanting to do. So with all of that, we've created 3 tiers of engagement, and this is still getting worked out. I was just in New York City for the past 3 days, and with Kelsey and our VP of peer-to-peer, Shannon Green, and this is the work that we came up with based off of all of your feedback. So within these 3 tiers, and the names will probably shift and change over time, but this is what I've come up with since landing back in Raleigh at 11 p.m. last night to help guide this. So our first one will be mobilizers, then we have our connectors and our ambassadors. And this is to reflect on the different ways you can plug into Shatterproof's mission. So right now, the here and now today, we're going to focus on tier 1, which is our mobilizers. So this is all of you, no matter who you are, no matter what level of engagement you are or how long you've been involved, everyone can be mobilizers of our work. These are quick, impactful actions that require no training, just a basic understanding of who Shatterproof is, and also get you out there doing the work that you've been wanting to do and waiting to do. Whether that's sharing resources, writing cards, or showing up to events, you can start making a difference today. All of these tiers, I believe, are interconnected, and as opportunities grow, you'll have the chance to deepen your involvement. But for now, let's just go out there and mobilize. Let's build awareness and let's get to work. I'll send the details of the other tiers in my follow-up that will kind of just explain a little bit more of that as we start to build that out. But I'll send some simple goals and what each of those tiers means. So Now that you kind of know how we're going to engage, how we're going to move forward, what our North Star is, let's talk about where impact fits in. So as we've talked about already, many of you know Shatterproof's work spans across several key areas, from transforming treatment to ending stigma and empowering communities. Understanding these functions helps you see the bigger picture and how your actions, big or small, contribute to real change. Some opportunities we'll share today are ready to jump into now, and others will roll out in the coming weeks or months or even days, because some of them are actually already posted on our portal. But no matter where you start, your role in this movement matters. So we're going to learn about each of that by talking about each of the functions in kind of tangible ways, so you all understand who Shatterproof is at a 360-degree view, not just in the functions you might have aligned yourselves with when you first started, kind of beyond that. So I'll pass it over to Kelsey to kick us off, and I'll take the rest of us off camera so you can just look at her face.
No, that's great. So as we jump into Shatterproof's work, peer-to-peer is really about the entry point for Shatterproof. It includes volunteer engagement and everything Gab is doing for the organization, and is really focused on community building and also fundraising for our mission. So the peer-to-peer team right now, we like to say we're small but mighty, of just a group of 7 people. We're executing the Shatterproof walks you see across the country and virtually. We have Team Shatterproof, which is our endurance program. We still have bibs available for the Marine Corps Marathon coming up this fall. We also do the half and full marathon in New York. And new for 2026, we'll be actually participating in the Tokyo Marathon. If anyone's looking for an abroad opportunity, you can definitely let us know. We also have our Create Your Own fundraising program, where people can develop their own fundraiser and awareness opportunity for Shatterproof, and we'll certainly help support them. And then, of course, this group here with community and volunteer engagement. Our walk to end addiction stigma, which I know Gab's going to be talking about more from a volunteer perspective, is kicking off again this year at the end of September. We're in 6 cities across the US in person, and we do have a virtual opportunity as well. We're excited to continue to improve the event experience. We have new fundraising incentives. We're showcasing our fabulous shirt design for this year, and an enhanced event experience. Again, we want to bring communities together. We're here to end addiction stigma and show the world that together we are stronger than addiction. I'm sure if you've seen our emails, you've seen all of those words linked together before. In terms of how to engage with our team, we have volunteer opportunities for the walk that are live. We have a walk committee. We are trying to develop more of a community experience this year. So we are having community teams in each of our walk locations, and we're looking for individuals to lead those groups and welcome people to Shatterproof and help educate about all of the work we're doing. So lots of ways to get involved with our team. Again, I know everyone else on this call is going to be delving more into the work that Shatterproof is doing, but the peer-to-peer team is really looking to bring the community into the organization, introduce everyone to the mission and the work that we're doing. And there are a lot of opportunities to engage with us, and that's why we have fabulous volunteers like you all.
Awesome. Thanks, Kelsey. Next up, we will dive into policy. So I will pull Kristen up.
Hi again, everyone. As I mentioned, there are 3 of us on our team. And you can see us in the Georgia State Capitol there. My boss, Kevin, mostly handles the federal stuff, which I know is what gets the most attention in the news and everything. But me and my coworker, Leah, handle our state advocacy. We split all 50 states between the 2 of us and travel a lot on the road. So hope to meet some of you where you guys live, and also available to help out on local policy when that becomes an issue. So I want to talk a little bit about some of the things that we work on, that we can work on, that we have worked on, but also point out that we're here to support you all in the advocacy that you think needs to happen in your community. So we have worked in all of the kind of 4 buckets of substance use disorder. So the whole continuum of care, from prevention to treatment, recovery, harm reduction. And then I do a lot of work around opioid settlement funds. So happy to talk about how people can get more involved in their local settlement fund boards or their state settlement fund boards. There's a lot going on in that space. For this this year, we have two main pillars of our advocacy work. The first is saving lives through prevention, and the next is quality care for all. I know those are big ideas. Our prevention work in the past year has really focused on implementing common sense regulations around recreational marijuana, not to change it for adults or to make it less available, but to make sure that the same kinds of laws that are in place for alcohol and tobacco are also in place for marijuana, just to make sure that kiddos are not having easy access to it. We know that, marijuana is not good for a growing brain. And we're also building out kind of a more expansive prevention advocacy effort at the state and federal level. And then quality care for all, real quick, I'll just talk. What we're focusing on is behavioral health integration and behavioral health parity. So making sure that people can get substance use disorder services at their primary care office, and that substance use disorder services and mental health services are covered under insurance in the same way that physical health services are covered. And then this past year, we've really been focusing also on the criminal justice population. So we know that when people leave incarceration, they're over 100 times more likely to overdose. So looking at making sure that people have warm handoffs as they leave incarceration and reenter communities to make sure that they're able to continue their treatment and get the care that they need. And then I'll just say one more time that if you all have something that you're passionate about that maybe doesn't fit in our priorities, but you think it's really important in your state, in your community, I have worked in the state legislature in 2 states, and I've worked with almost all the states in the country. So I am more than happy to help people strategize or think about how to get a bill passed or how to advocate for a law or a change in your community. So I look forward to hearing from everybody. And Gab put in there some of our links around our action center, some of the things we have live right now, and ways to sign up to engage in the future.
Awesome. Thanks so much, Kristen. And I'll pass it over to Laura.
Thanks, Gab. So as I said earlier, I work on the Treatment Atlas team. And Treatment Atlas is a free online treatment locator. It's available to anyone who's searching for STD care, either for themselves or someone else. On our platform, we currently have data from over 4,000 treatment providers across 14 states. And one thing that I just want to note really quickly is that you don't have to live in one of the states listed in order to access Atlas. You can search for care even if you live in another state, but we just don't have information on providers outside of these 14 states listed, although our long-term goal is really to make Atlas a national resource. And I also won't go too in-depth walking through the website itself. I would just really encourage you to check it out when you have a second. I will say that Atlas is designed to really make the search for treatment very transparent and individualized. So when you go onto our website, you can either search for treatment directly, or you can take an anonymous brief screener to help you determine your level of care when searching for treatment. And when you're viewing treatment programs on Atlas, you can use the filters that we have on the website to really find treatment that will meet your needs. So you can search for things based on payment options that are available, special populations that are served, and best practices available. Our Atlas team really has 3 main priorities when we're doing our work. So we have a state engagement team on Atlas, and we have a data and platform team. The state engagement team is really the team that's out in the community, spreading awareness of Atlas and helping to keep Atlas alive where we are. So our first main priority with Atlas is sustainability in our current states, as well as expansion into new Atlas states. Our team also works really closely with the treatment provider community to ensure that the data that we have on our website is not only accurate, but that it's really up to date. We collect data every 2 years, just to make sure that the information we have is relevant and that it's helpful to the communities. And then we work really hard on the engagement team to just work with communities to spread the word about Atlas, let people know that it's available, and really encourage individuals to use the locator itself. And that's where I think that we can work really well with you as volunteers to really connect with the communities, to share your story if you've used Atlas, or if you've been to a treatment program that's on our Atlas website, to anonymously share how your experience at treatment was so that you can help others searching for care. Spreading the word within your communities that Atlas is a free resource and that it's available, and really helping to build relationships with organizations, again, to get the word out that this is a resource, it's available, and it's free for anyone to use. So again, I encourage you all to look at Atlas when you have a second. I know that Gab, I think, shared it in the chat, and happy to answer any questions at the end of the call today.
Awesome. Thank you so much, Laura. And lastly, I will pull up Jody.
Okay, I'll jump right in. I won't go through all of these bullet points, but pretty much the basic overview of what we're doing on the stigma team is that we are trying to address different types of addiction stigma, specifically public stigma. So that's the stigma that the general public holds against addiction, structural stigma. So that could be things like policies and healthcare. Self-stigma, the stigma that people who have substance use disorders might hold against themselves, and then the stigma around treatments and tools like medication for opioid use disorder and naloxone. And so we use an evidence-informed strategy to deliver public health campaigns to various states. And the idea is that through the power of social media, we'll be able to share the stories of people who are directly impacted by SUD. So that's people who are in recovery, their loved ones, people who are working in the field. And we curate these stories according to the needs of the state. You can go to the next slide. So this, oh no. Well, the idea, really what I want y'all to get is what's directly in the center, is that we have a collective impact model where all of our work is curated with community and it's driven by community. And I truly believe that that's where we can see volunteers fitting into what we do. We are continuously improving. That's the beauty of kind of having like a digital platform hybrid with in-person, is that we're always able to tweak it and make adjustments so that we can keep getting better. And so volunteers could potentially serve on our community impact committee if you are in one of our states, which I'll talk about in the next slide. Volunteers can also support us with in-person activations. So that could look like tabling events, other organizations' walks. Sometimes people want us to just, show up to different events that they might be having. And our team is fully remote, so that becomes difficult, especially in a big state like California. So I know we have a couple people on the line who are from Cali, so would love to connect and make sure that we're able to spread out. And then on the last slide, I'll just go through where we're currently active. So as I mentioned, we have a campaign in California. We also have a campaign in Michigan and Georgia. Pennsylvania was our first campaign, a pilot, that we work in collaboration with Penn State and another marketing firm called PGP. And we just wrapped up our Kentucky campaign, although it still lives on. We're just not the ones that are doing it. The Kentucky organization decided to continue doing it themselves. And then we'll be launching in North Carolina in a little less than a month. So we're really excited about that. So if any of you are in any of these states, there are absolutely opportunities that we can present for in-person activation and or serving on our community impact committee. And Gab did drop links in the chat for our California campaign, our Georgia campaign, and then our Pennsylvania campaign.
Thanks so much, Jody. Wow, I'm so proud of you guys. Got that good. That was concise. I feel informed. I hope all of the volunteers feel informed. We're nearing the opportunity to ask any questions or inquire about anything else. So feel free if you want to start posting those chats in or those questions in the chat. I will go through our next few slides and then we'll have an opportunity to open the floor for all of you. Awesome. Well, thank you all. Like I said, I also wanted to note too, so Shatterproof does a ton of work. It's not just I think there's 4, 5, 6 I don't know. There's a few of us here. Um, we do so much more work. We are a 70 plus employee organization. We have multiple types of boards. We have a New York City Junior Council. All of you exist. So we touch so many areas. In my opinion, I think the most tangible volunteerism engagement that we have right now is this functional work, which is why I pulled all of them in. In my follow-up, though, I do want to highlight the other functions that do exist across Shatterproof. And as we start building out educational materials, we'll still share more about those different functions that exist and how you all can talk about them, interact with them, things like that too. So just wanted to say that as well. And of course, if you go to shatterproof.org, you can find all of the work that we're doing here, including an even deeper dive into all of the work that all of these lovely ladies talked about today. So let's just take a few minutes to wrap us up. And bear with me. So I do want to talk about the portal, but I'm actually going to jump to my next slide and then jump back because I'm going to have to reshare my screen to a different side, and I want to make sure I don't mess up everything. So I will talk about some dates first. So I just wanted to set a reminder that there's some important dates happening throughout the year, and I'm sure I missed many dates that are happening as we're a national organization and there's a lot going on. But I just wanted to make sure that you have some initial dates top of mind. Some of them were talked about today. I did not put in the North Carolina stigma initiative release on this calendar, but I'll make sure to send that out in my follow-up too. And if you're in North Carolina, we'd love for you to partake in some of their activities. I also wanted to mention that hopefully, fingers crossed, our next all volunteer call will be September 16th. There will be other opportunities to engage in between then. It's not like we're not going to talk to you ever again until September. We'll still have connection opportunities. It will be around 7 p.m. Eastern Standard Time again, unless the post-meeting survey, you all give different advice on different times and days that you all prefer. You'll also still be getting our bi-monthly volunteer progress update and communication and other follow-ups from me, so keep an eye out for those as well. I did want to say I believe that my email might be going to people's junk folder because it is an organization-wide email. So I would love for all of you to save my email and the volunteer email, which I'll put in the chat just as your safe sender. And anyone here, like we have some general walk emails. I know there's policy and atlas and stigma emails as well. So anything Shutterproof wise, even if you want to add the domain as a safe sender, please do so that way you don't miss any communications that we send out as well. Great. Well, I'm going to bump back to the portal before we open it up for questions. So I think really the first step for all of you to make sure that you're up to date with what's happening, that you're engaged, that you can sign up for opportunities is to create a profile on our brand new volunteer portal through Galaxy Digital. And I just want to take a few minutes to just quickly show you all how to use it. I will put the link in the chat, and if you're able to, feel free to open it up alongside me, and if not, no worries. I'll also be sending some general instructions after today's call. But if you're also having trouble creating a profile today or afterwards, it's probably because your email's already in the system. If you volunteered or signed up to volunteer at Walk last year, your email's already in the system, so there might just be a password barrier. Happy to support you on that end too. You can email me at volunteer@shatterproof.org or my personal email as well, which most of y'all have too. So let me share my computer screen. Let me admit Carrie, and then I will go over here and share this. Let me pull it up because it actually is just showing my face. Okay, let me know give me a thumbs up if everyone can. Laura, and I can see your face. Can you see it, Laura? Okay, cool. I see thumbs up happening all over. Yay. Okay, perfect. So this, for those of you who haven't seen it, this is our new volunteer portal. I am logged in because it would make me do a bunch. It would make me log out and log in and all these error codes since I'm in the system every day. But you should be able to access this link and click around even if you have a profile or not. To sign up for opportunities, though, you do need to create a profile. But like I said, I recommend everyone create a profile. When you create a profile, you'll go in here and it'll have an opportunity to sign up to volunteer here, create a profile, log in if you already are a Galaxy Digital user, things like that. It'll ask you some basic questions. Not everything in the questions is required. And there'll also be an opportunity to sign off on our volunteer consent form, which is new for everyone here to fill that out. That's our new one, and we'll have that refreshed every 6 months. And creating a profile here really is just to help us know who you are, how long you've been engaged with Shatterproof, make sure we have the proper addresses so we can mail you thank you cards and mail you any swag if you ever have any tabling opportunities that you're doing. Also know what t-shirt size you are, just simple basic things so we can best engage with you and make sure you're in the know of work that best aligns with the work that you're wanting to do. So when you're here, you'll see this is our main homepage. You can click out of this, and when you're on here, you'll be able to see some really cool things. So first of all, you'll be able to see all of your volunteer hours with Shatterproof, which is really cool. It also quantifies how much money that is. So how much money you're saving Shatterproof with how many hours that you volunteer with us, which is incredible. It'll also show you how many opportunities that you have signed up for and you are signed up for. You can also view your volunteer resume, which is really great, especially if you're wanting to utilize your volunteer efforts in any work or community connection. As you scroll down, you'll see our walk one is our main one because it has the most opportunities. And you'll see a variety of walk opportunities that pop up here. You can also choose opportunities based off of your skills. So let's say you love to come to an event and you love to do physical things. You love to lift tables and move bins and all of that. If you want to have physical as it, if you are enthusiastic and love collaborating and connecting with people, and you only want opportunities that are specific to that, you can also filter it out that way, or you can look at every opportunity that exists as well. You'll also see some down here, and we're still building these out. Connection call crew are some calls that pop up. I'm working directly with Laura on developing out what those opportunities look like. And we also will have some pop up throughout the year for thank you calls to fellow volunteers, to engage with our walkers, things like that. And we'll also be building out our community engagement champion work here too. So you're able to click on these programs through these gray boxes, or you're also able to click on them on the left-hand side as well. I'll start with the walk because that's just the easiest one since there's the most going on. So you'll see all of the information for walk. I have tried to make it easier for people who are wanting to go to walk and divided the opportunities by walk site. So you're able to actually click on the city that you're wanting to volunteer at, and it'll only show the opportunities that exist in like Chicago. You can also filter that out too, but just in case. So once you find an opportunity that you want to do, you'll click view details, and you'll read about it, learn about it, and then you can click respond or respond as a team. If you click respond, this just as an individual, which is fantastic. And if you respond as a team, you'll be able to kind of be the team captain and hold a bunch of spots. So let's say you're part of a local Rotary Club and you want to bring them out, you'll be able to sign up your whole team to come support that role. This process will be exactly the same for every single opportunity you sign up for across our organization as they start to pop up. The reason I want you all to be on this is because I'll be sending out notifications. You'll also be able to say, like, if there's any opportunities for volunteers who are enthusiastic, I want to get a notification. So that way you're in the know too. It's just a great way to keep track of all the work that you're doing and for us to make sure that we're providing opportunities that are meaningful to you. And the last thing I wanted to call out too is we have our support and answers tab. I'm also working on a resource tab where you'll be able to find all of the links I shared today. You'll be able to actually find those all in one place, which I think will be really helpful for all of you out in the community. But any support and questions that you have, you'll be able to scroll through our support and answers tab. And of course, you're always welcome to email me or call me. I'm always happy to lend a helping hand. So just wanted to open the floor for that. And then with all of that, I would love to open the floor to all of you. So I'm going to actually stop sharing my screen completely and see if any of you have any questions. And if anyone has said anything that I should call out, definitely let me know. Thanks, Judy. I'm glad you think it looks great. Anyone else have any questions? I'm scrolling through to make sure I didn't miss anything. Yay! I'm excited for you to be part of it too, Alex. It's always fun to have representation in states that we don't have a ton of volunteers. There's about 3,500 people who have shown interest over the past 8 years, but about 200 of you have re-raised your hands. So the more engagement we have in states where we don't have anything like brick and mortar, like a walk, or maybe Atlas or Stigma doesn't exist there yet, there's other opportunities, like you heard Kristen talk about policy, and there's also, hopefully, as we start to mobilize y'all, a lot of community engagement work. And thank you for sharing Minneapolis as well. Oh, I see Christy has her hand up. 1 second, Christy, let me see how I can do this. I'm excited. Just bear with me. Oh no, maybe I can't unmute you. That's weird. Oh, maybe if I make you a presenter. Oh, bring on screen. Maybe that'll work. No.
Hey.
Oh, can you unmute yourself by chance, or is it locked? You should be able to unmute yourself now. Oh, there you are. Okay, perfect.
Hey,
Hey.
Perfect.
so what opportunities do y'all have available in Georgia?
Would anyone like to talk about Georgia? Anyone else have anything on the team?
I can jump in first. Christy, one immediate one that I'm thinking of is if you wanted to share your story, if you're a person that is impacted by SUD, would love to collect it. I'm gonna keep it very 100 with you. Our contract is up at the end of next month. However, we want to continue to engage in the state. We've built a lot of great connections with community there. And so I could see like future opportunities to just attend different events, like I was mentioning before, that might be happening. Other walks, like I know Forsyth County just had their walk, and we had some people that attended that. So yeah, those are kind of the two things that are popping up for me, but definitely sharing your story if that's something you're interested in, and I can drop the link to sign up for that.
That'd be great. Thank you.
No problem.
Yeah, and I posted, oh, sorry, go ahead.
I'll just add real quick that we did a lot of advocacy work in Georgia over the past couple years. I think 2024, I was there like 6 times in 4 months. So we did a lot of work. We've had a couple of small wins there, and we are trying to get Atlas funded through opioid settlement funds. So we have not quite regrouped after sessions were over this year, but I'm sure we'll have opportunities on the advocacy front coming up soon. We can keep you
Okay.
posted on those, Chrissy.
Thank you.
Yeah.
Awesome. Thanks, Christy. Anyone else have anything
Thanks
they wanted to
all.
add?
Herman has his hand up.
Oh, perfect.
Oh, sorry.
Let me bring Herman up. There we go. Once you're up on screen, there you are, Herman. You should be able to unmute yourself.
Okay.
There you
I
are.
think I did.
You are.
Hey,
Hi.
how you doing, Gabby? Good to see you again.
Good to see you.
Hello, everybody. I'm gonna call you guys the panel. How y'all doing? Thank you for the excellent information. You know, we've been waiting for this. I know I've been waiting for this. I tuned in an hour earlier because I'm on Eastern time, so I thought it was 6 o'clock Eastern time. So I've been waiting. I have a question for Christy. I love to engage in advocacy and policy regarding addiction stigma and self stigma, and I'm in New York.
Okay.
So I would love to help or participate in, whatever Shatterproof is doing in the East Coast, if they're going to Albany, Albany's a hop, skip, and a jump, whatever efforts that need a voice or that need an ambassador to speak on the three pillars, I'm more than willing and able to participate and lend my voice to the charge.
That's great, Herman. Thank you so much. My colleague Leah covers New York, so I do not have the most up to date about what's happening on our advocacy work. I do know that we worked with, and now I've forgotten her name. We worked with a state senator. I worked with her staff in New York to mandate local reporting of settlement funds. As it stands right now, we have no idea what local governments are doing with those funds. So there was language passed through the budget to make sure that the local governments have to report to the state and provide some accountability and transparency there. So I will connect with Leah and let you know if there's anything going on right now that we could use some help on.
Okay, great. And before I leave, I just would like to say I have 32 years lived experience, and I would love to put my story in the blog. Miss Jody Ann, I think Jody Ann was talking about putting your story in the blog, so I wouldn't mind doing that either.
Awesome. Thank you, Herman.
Thank
Glad
you.
you're here. Good to see you. And I appreciate you coming up and asking a question. And Kristen, there's a question there if someone can ask a general question about settlement funds. Kirk, were you wanting to come up on screen or were you wanting to ask the question in the chat? Either way is fine if Kristen's good to answer that.
Of course, yes, if I can. We'll see.
Let me see. Let me try to pull you up, Kirk. Let me see if I can. On screen would be easier. Perfect. Let me pull you up. Okay, you're up on screen. You just need to click your unmute button and you'll be good to go.
Can you hear me okay?
Yeah,
Yep.
perfectly.
Great. I live in a small town in Massachusetts, and I just started, I got curious not very long ago about what they were doing with the money, and I was able to see how much money my town is getting, more or less, and it's quite a lot. I also found, later on, I found the report for the town, and they've so far spent 1% of that money. And I want to ask you, Kristen, if this is a pretty typical scenario. Is this something you're seeing a lot of? My impression is they don't know what to do with the money. And I don't know what to do with the money either, but I want to help.
Yeah, what town are you in?
Norton, Massachusetts.
Okay, yeah, I lived in Massachusetts for a long time.
Oh, okay.
I'm putting a link in the chat. This is a project that Shatterproof did with Johns Hopkins University and KFF Health News to track all of the publicly available expenditures of settlement funds around the country. Sorry. So if you are curious, if there is a report on how your local government or state has spent money, you can find it there. To directly answer your question, Kirk, it's not uncommon. I think some places are sitting on money and letting it build up so that they can use a big chunk and make a big investment. Other places, I think you're right, don't know what to do with it. And so, we're getting to the point where that's no longer a good excuse. They've had money coming in since 2021. So we totally understood taking some time to be strategic and thoughtful. A number of jurisdictions have done needs assessments. They've done community engagement. But we are kind of getting to the time when it's time to start putting that money out into the community. So I am happy to look into, you said Norton, Massachusetts?
Norton, yeah.
Yeah.
But I think I don't think it's an unusual situation. That's my, on one hand, I'm glad that they're not spending all this money on new police cars, if you can follow me.
Well,
but
some places are.
Well, on the other hand, I would like to see it go to a good cause, and I'm hoping that soon I can help with that.
Yeah, I would say, in the meantime, reach out to your county commissioners.
Yeah.
They likely, I guess in Massachusetts, it's not county, right? Probably your town council, and ask them what they're doing. Like, what's going on here? Who's making the decisions? How is this process working? As I always tell people, and my colleagues are sick of hearing me say, your elected officials work for you and your taxes pay their salary. So they should be responsive if you have a question.
It was an interesting conversation. I went into the public health office at the town hall, and boy, he didn't want to talk about this at all. He said, "You go straight to the police chief." It's almost as if I had asked the wrong question. And I thought, well, it seems like the health department should somehow be involved.
Yeah. Interesting.
Okay, thank you.
Yeah.
Awesome. And then I think the last question we'll do is from Arthur. I will answer that and then we'll end today. But of course, y'all are always welcome to ask questions. You can always email me, post in the Facebook group. I know, if Kelsey, can you post the Facebook group link in here? I know it says ambassador group. We're going to change it to volunteer group just because as we're kind of kicking off tier 1, we want everyone to be involved. As for Arthur's question, I think it's actually a great question to wrap us up, is that Arthur asked, I've been helping in Boston before. Should I stay posted to my Shatterproof emails, not in spam, thank you, to see what might happen up your way? Well, yeah, so if you've been involved with a singular event, like a walk before, I know that it's been frustrating that there maybe has only been that one opportunity to engage a year, or you've kind of been waiting. So that's what tier 1's going to do. We're going to be able to give y'all these easy, tangible, no barriers to access opportunities to get engaged. So that's going to be going out in your community, like grassroots efforts, going back to what my VP said the other day, going back to the 90s, like posting stuff on bulletin boards. We want Shatterproof to be a household name. We want to be able to show people that we have Treatment Atlas. You know, I know it's in 14 states, but it's still a helpful tool. We have the SASE, we have the Principles of Care. We're doing advocacy work in practically every state across the country. I don't know how Kristen still stands up after all the bebopping around she does. So we want to be able to give y'all easy ways to get engaged. So yes, stay tuned right now, but there's going to be some really simple ways in the next few weeks that I'll be emailing all of y'all to engage in those tangible, easy ways. So definitely make sure to check the portal, check your email, make sure, like Arthur said, I'm on your not spam list, and also sign up for Shatterproof newsletters. They like to spotlight different awesome things that are happening, positive things that are happening. You can always share things on social media that we post, tag us in social media. Our social media team loves to repost people's stories and posts and things like that too. So yeah, thank you all so much for being here. Like I've said multiple times throughout this call, since starting at Shatterproof 6 months ago, I've been in incredible awe of not only all of my colleagues, but all of you. I am just truly inspired by your passion and your stories, your vulnerability, and also your kindness. So excited to just continue to work together, put some action behind the words. And so yeah, stay tuned and I'll talk to all of y'all very soon. And thank you all to the team for being here and presenting such awesome work. Have a great rest of your night and a good weekend.